Hi, I'm Eric Crowell. I'm an ophthalmologist subspecializing in uveitis and ocular immunology at the Mitchel and Shannon Wong Eye Institute associated with UT Health Austin at the Dell Medical School. I chose uveitis and ocular immunology because it's an underserved area of ophthalmology. There's not a lot of ophthalmologists that actually choose to practice in this subspecialty. Additionally, when I was going through my training, this patient population seems to not necessarily get the treatment that they always need. And a lot of that stems from the fact that not a lot of physicians, ophthalmologists go into this subspecialty. We had a uveitis specialist start in my residency program, and seeing the difference between where those patients started and then just a year later with her interventions really showed me that those patients can see a whole lot better and can do a whole lot better, and that's what really inspired me to go into the field. When a patient comes to see me as their physician, I'm going to first sit down and talk to them and figure out what is their problem, how's it affecting their life. A lot of times they've already seen multiple other ophthalmologists or other physicians, and I want to know what has been done in the past and what they've tried in the past and kind of start from there, because you don't always need to repeat everything again. It's a partnership, so you want to know what are the aspects of treatment of the different diseases that patients might come to see me for. What is that treatment going to look like in their life, and how is that going to affect their life? And you have to work with the patient in order to make sure that if I'm prescribing something for them to take, that actually works with their life and that's something that they will do. If not, there's no point in even doing that medication. You need to make sure that it's going to be something that works for the patient. The most rewarding aspect is just getting a great patient outcome where the patient is super happy because you've finally been able to diagnose what their disorder is or what the problem with their eye actually is, and institute a treatment plan that actually solves their problem and meets them where they are in needs in terms of treatment. So just the look on their face when they can finally come in and they can see you better is the best thing in the world.